What will Brian Peskin's PEO solution talk cover?
Well, it's going to talk about how to combat inflammation and reduce patient pain. But I'm going to start with, how do you analyze a study or an experiment to begin with? Because there's studies, experiments, and associations, and there's relative risk and absolute risk. So I want to give physicians the tools so they can analyze a study to see if it's correct or not, to see if the treatment really is effective or if it isn't. Because there's two ways to go: what the trend is, and then what your actual patient's risk is. So that'll take a few minutes, but it's extremely important. Then we'll go directly into inflammation, because inflammation causes hypoxia, lack of oxygen, and that's a direct cause for diabetic neuropathy. And diabetes, as everybody knows, is one of the biggest epidemics there is. Very, very painful. Hypoxia is also a root cause of cardiovascular disease, cancer.
Who is the intended audience?
Any physician, but in particular diabetic physicians, cardiologists, cancer physicians. I mean, inflammation is everywhere. It's systemic today, and it leads to the root cause of most illnesses. So if you can combat inflammation, you've gone a long way into minimizing many of the illnesses that physicians see every day today.
Who will the PEO solution help?
The patients this will help is absolutely diabetics. Any patient wanting to lose weight, and that's almost everybody, because if you haven't noticed, we do have an obesity epidemic. So the right oils that I'm going to talk about actually fulfill the appetite. And once that happens, guess what? The sugar cravings, the craving for sweets, are highly diminished. So if you have the craving, you don't eat it. You don't eat it, you don't become overweight. So that's a major factor that helps almost everybody. But cardiologists, any heart patient, there's a vast amount of effects on anti-inflammatory helps, and the proper oils that I'm going to talk about do much more than just providing anti-inflammatory. They're anticoagulative, anti-adhesion of the platelets to the arterial vessel. They provide ideal structure to the intima, which is the most inner lining of the artery. So heart disease is by far the number one killer, so a huge effect in there. Cancer is number two, and by helping hypoxia reduce that and prevent it, goes a long way to anybody with cancer or in remission of cancer. So you talk heart disease, cancer, and diabetes, those are enormous. Any dermatologist, the skin effects are absolutely phenomenal. And again, the external skin ties into the internal with the epithelial tissue. So all the carcinomas are epithelial tissue based. So it's just so cohesive that what I'm going to talk about is just very, very profound. So I'm very excited to be there.
A few things you'll learn.
Three major points that they'll take away: what is causing the epidemic of inflammation, how to fix it easily and inexpensively, and the mistake that you could be making taking fish oil in the normally prescribed doses, how they're very inflammatory and not what people think. Those are the top three, and also how to properly analyze the study, because the fish oil is so highly promoted and physicians think that it works, is because the studies are misinterpreted and analyzed improperly. So it's critical there. So there's four key things that everybody will be able to take home and put to use immediately.
Register today at acam.org/ACAM 2014 or call 1-800-532-3688.